Imagine if all of our patients had an amazing sex ed growing up through like middle school and high school. We would be answering like only 25% of the questions that we're faced with on a daily basis. I think it would be awesome if partners could come into every consult with at least some understanding of what the other has to go through. So that way, we can help both of them get to a point of like even greater education and understanding.
As men's health specialists, we know guys are shaving their balls. Yeah, we examine a lot of you, so we literally see it, but we also have the data showing it too.
That's right. According to research, over 85% of men trim their pubes. Not only that, but research shows that over 70% of women prefer a partner with at least partially trimmed pubic hair.
So guys, we know you're trimming the hedges, and we know that most women prefer you manscape. So if you're going to shave your balls, why not use the best men's grooming kit around? We're talking about Manscaped.
With the Manscaped Performance Package 4.0, you get the Lawnmower 4.0 with their all-new skin-safe electric trimmer that protects your balls from getting those cuts we've all had in the past. You also get the Weed Whacker 2.0 for trimming your nose and ear hairs. And let me tell you guys, we all need to do a better job of this.
Yep, that's right. Kevin and I both have the performance package, and we really love it. Manscaping has never been easier for us. And for our listeners, we have a special promotion. Go to manscaped.com and enter promo code MANUP and get 20% off your first purchase.
Go get your Manscaped products today. Your balls and your partner will thank you. This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists in the field on various topics in men's health. You have questions that you are too afraid to ask. We have the answers. This week, our episode is titled Conversations on Fertility. I'm Dr. Kevin June. I'm joined as always with my co-host, Dr. Justin Dubin. What's good, Justin? How you doing?
Kev, what's going on, man? Happy, I guess, Monday when we're when this is going out. I'll just be getting home from Chicago. A nice summertime shy trip. Nothing better than summertime.
It's the best time of year in Chicago, right?
Oh my
God! It's
the
summers.
Your sister knows, man. She's there. So,
my sister actually came out to LA this last week, and she was. I mean, I'll preface: LA weather has been goddamn awful. Like, it's literally just been like gray skies for like 6 months.
Right.
And she comes out here and she's like, why would anyone ever live here? You got to live in Chicago. I'm like, dude, you got like amnesia from the winters, But the summers are amazing.
Summertime shy is worth all the cold in the world. No summer city beats it. Absolute facts. Having lived there and experienced myself, the cold is worth it. Having said that, I'm very happy in Miami.
Wait, what are you doing in Chicago? If you don't mind me asking?
I'm going to a wedding. Shout out.
Amazing.
Mike, congrats. It was a great wedding. I haven't been yet, but we're traveling in time. It was a great wedding. Had a good time. Yeah. So, what?
Well, what I was gonna transition to the episode, but do you have something else to say?
No, that's exactly what I was going to do. You read my mind.
All right. Well, hey, this was an awesome episode. We were joined by our good friend, Dr. Adriana Wong. I'll let you introduce her, Justin.
Yeah, Dr. Wong is actually a really good friend of ours. We've known her for several years, and she's the current chief resident of the OB-GYN program at UC Davis, and she's actually soon to be a reproductive endocrinology and infertility fellow at the University of Southern California. She's going to be in Kevin's Woods over there in LA. And, she's done a really good job. She has a great social media following. She's really passionate about educating people about fertility, especially female fertility. So we thought this would be a really fun opportunity to bring her on and just have a conversation. All three of us talk about some common questions that men ask about fertility, common questions women ask about infertility that we thought would be very informative for both men and women to hear. And I think it's always great to have these conversations because sometimes we hear some stuff that, I never would have thought. Sometimes you need the other specialties to bring in questions. And if you listen to Dr. Crawford's episode last week, thank you for listening. We obviously went into detail with the IVF process, but this is kind of more generalities, a lot of more general questions, lifestyle questions, things that we get very commonly that we thought, we kind of went really deep in the last episode. We're kind of taking a step back here.
You're absolutely correct, Justin. I mean, I think the whole fertility thing is, it's become more mainstream. A lot more people talk about it now. And so, what I was really happy with how this episode kind of came out was that we just sat around and we chat about these general things that you would amongst your friends, but we try to kind of include the information, some of these answers to those questions that you may have. And, in a really informal setting, we just kind of sat around and just chat about male fertility and female fertility. So it was a great episode.
Yeah. I mean, and one thing obviously is really highlighted here is that if you're going through, family planning issues, you're having struggles with fertility, this is a conversation. We're having a conversation as male infertility doctors and as reproductive endocrinologists, female infertility doctors. We're having that conversation because this is a conversation we frequently have together in the professional environment. So there's no reason to think that if your partner is going through one side, you should not be going through it either. You both should be going through that process. And just the way that we're having conversations about this with each other on a professional level, you and your partner should be having conversations about fertility, asking each other questions, and having these both at home and in the office. I think one thing that we've talked about in the past year is supporting your partner. Guys, go to your partner's appointments. Ladies, go to your partner's appointments. I think that the communication and the conversations that come from that and the support really goes a long way.
Support is very important. Look, the fertility process can become stressful. It can be,
Absolutely.
Hopefully for most people, it's fine and there's no difficulties conceiving. But, if you're kind of listening, maybe there may be an issue, and so, it is a stressful time and, you just got to be there for each other. And the more informed you are, the better off you're going to be. So really hope you enjoy this episode.
Absolutely. All right, guys, as always, enjoy the episode. Download, subscribe, give us a review on all podcasting platforms. Really appreciate the reviews. Really helps us out, goes a long way. If you can give us a review, give us a comment on iTunes or on Spotify, follow, subscribe us on YouTube, always goes a long way. So thanks for listening and enjoy the episode.
One of the major reasons we do this podcast is to destigmatize conversation in men's health, and that includes mental health. Mental health constantly comes up in our podcast because it can impact so many other aspects of your life. That's why we are sponsored by BetterHelp, the world's largest therapy service.
And listen, guys, we get it. Talking about this stuff can be hard, but BetterHelp makes it that much easier because it's 100% online, so you can get the help you need from the comfort of your own home.
With BetterHelp, you can tap into a network of over 30,000 licensed and experienced therapists who can help you with a wide range of issues. To get started, you just answer a few questions about your needs and preferences in therapy. That way, BetterHelp can match you with the right therapist from their network.
For our listeners, we have a special deal. You get 10% off your first month at betterhelp.com/manup. That's betterhelp.com/manup.
So make sure you're taking care of your mental health and sign up for BetterHelp today. On today's episode, we are joined here by Dr. Adriana Wong. She's the Chief Resident in OB-GYN at UC Davis and soon to be Reproductive Endocrinology and Infertility Fellow at the University of Southern California. So today we're going to kind of change up the format again. This is just going to kind of be a relaxed conversation, just talking about common infertility questions that all of us, me, Justin, and Adriana, all kind of get on both the male and female side. So we're going to just kind of have a little conversation back and forth, try to answer as many of these questions as possible about infertility.
Thanks, guys. I'm so excited to be here. It's also really great to see you guys again.
It's good to see you.
It's always good to see you, for sure.
Okay, so obviously as an OB-GYN, I'm most often seeing women by themselves in my clinic, but often I'm also addressing questions that women have. So one thing that I recently wanted to ask you guys was, how do men know if they're infertile? Is there anything that they need to look for?
Justin?
I think you brought up immediately an interesting thing that most of the time in your office, there's women, because Kevin will attest to this. I would say almost 50% of the time guys come into our office for a fertility evaluation. Kevin, who's in there with them?
Their partner.
Their partner. Exactly. And I think that that's a huge issue, that, and a sign that a lot of the guys, at least when we talk to them, they don't know about fertility. They're only going in because their partner is going to, pushing them to do it. And really, when we're looking at 15% of couples who are struggling with fertility, there's this stigma that women most, carry this burden of couple fertility. But as we all know, that's actually not really the case. About 50% of the time there's a male factor involved. And about 1/3 of the time, it's actually strictly a male factor problem. And really the question is, how do men know if they're infertile though? Well, there's a lot of things that impact fertility, and we're going to go into detail with a lot of them, but there's lifestyle, medications, medical problems. But most of the time, really for men, they wouldn't know unless, they're trying to have a kid and it takes a really long time and they have to go get a doctor and get checked out. I think most of these guys really live normal lives, and you really can't point a finger at most of these people and say, oh, this guy is a guy who has infertility. And I think that's a reason why guys should always go see a doctor, establish care in general. But if you're concerned about your fertility with your partner, you really need to go see a doctor. I don't know, Kevin, what anything else I'm missing here?
No, I think you make some great points there, especially a lot of guys that I see in my clinic who are there for male infertility. This is their first thing that has kind of come up for them in their health that they have issues with.
Right.
They're like, hey, I'm kind of here. And yeah, you're absolutely correct. They're there with their partner. A lot of times they'll be like, yeah, why don't you ask her, like they don't really know what much is going on. That's just guys, right? That's just simple
Absolutely
guy stuff.
Not. No idea.
No idea. But, it's, this is the kind of thing that Justin says. You're just kind of living a normal life. And then next thing you know, you could be like, get some news that, hey, look, there might be something that you're contributing towards this, infertility process. And, it kind of leads to something else in terms of are there signs or symptoms of, male infertility, right?
Mm-hmm.
And, in general, there are none, basically, like Justin says, you're kind of walking around normal things. You may be told that you have something called a varicocele, which is a little bit of swelling.
Right.
Maybe you've had a finding that you do have some sort of genetic component, but these are more rare than not. Things that are, such as low testosterone, you may not have symptoms of. And so that's why, you got to get to your doctor and kind of, talk about some of these things.
Yeah, that's so interesting. Actually, I saw this couple today in clinic because I'm actually on my REI rotation. And, just kind of from our side, we described all of the things that we would do on our end and what we would test. And I was shocked because for the first time ever, her partner was like, it's okay, babe. Actually, I think I'm going to go ahead and make sure that I get tested first to make sure that everything on my end is good too. And I was like, I have never seen a man say that before in any of these consults. So,
well, here's the thing. How many of them actually, shout out to him, but how many of these guys, or how many times is a female patient of yours complaining, that their partner doesn't want to get worked up? Is that a common thing that you do hear often?
It can be. I mean, I think people overlook the male factor to infertility, and they often think that, they assume a lot of blame. And so I think, there are certain circumstances where men aren't open to even having the conversation about having a semen analysis or having that check-in with their doctors.
Adriana, let me ask you a question. So, we're here, we're talking about common infertility questions, right? Just common infertility questions. Do you think that both sides in the relationship who are trying to conceive should have a good knowledge base and kind of background on both sides? Information that can potentially contribute to a female factor or a male factor. Do you think that's important?
Yeah, I mean, I think that would be awesome. I mean, I think that's what, a good sex education and good background in reproductive healthcare would I mean, imagine if all of our patients had an amazing sex ed growing up through like middle school and high school.
Oh.
We would be answering like only 25% of the questions that we're faced with on a daily basis. But yeah, I think it would be awesome if partners could come into every consult with at least some understanding of what the other has to go through. So that way, we can help both of them get to a point of like even greater education and understanding.
I think that's a great point. So, guys, listen, a lot of times your partner is willing to make the trip to the office with you. I think it's important you show support and also make that trip for your partner as well. And I think the next question really for you comes down to this education idea. Yep. And I know it's a simple concept, but I think guys really need to understand this. Can you explain the ovulation cycle and, the female, fertility window to our listeners? Because although it sounds obvious, I think I find myself explaining this a lot in my clinic and how it works and how you want to time sexual intercourse.
Yeah, happy to. So we start having menstrual cycles in our adolescence. Usually it's around 12, 13 years of age. And it's all in preparation to get pregnant. So we will have a cycle that's generally 21 to 35 days. Our ovaries will have a dominant follicle, which will ultimately release an egg. The egg will be released in the middle of the cycle. It hangs out, and if it doesn't get fertilized by a sperm, then your uterine lining will shed and you have a period. And the period can last anywhere between like 2 to 7 days. Your fertile window is the time period in which you're the most likely to get pregnant. So it's the 5 days leading up to it, and also it's the 6 days. It's a 6-day period that you're the most fertile. It's the 5 days leading up to ovulation and the day of ovulation. So it's that 6-day window. And generally, it's 14 days from your anticipated next period. So it's actually kind of confusing because you actually count backwards from when you think your next period will start. So in like the old days, when people were trying to figure out when they were, quote, the most fertile, they would actually just, calendar method, figure out based on the dates when they were having their periods every single month, and then count backwards about 12 to 14 days. And then as long as you're having intercourse in the days preceding, and also usually 1 to 2 days after when you think you may be ovulating, you're most likely to get pregnant. Now, there's a lot of apps or fertility trackers that people can use. And all those apps are doing is basically doing that same counting backwards from when you think your period may be, based on the patterns and the data that you're putting into them.
Interesting. So
it is interesting.
It's interesting. Sorry, it's interesting because like kind of it's not as set in stone. Like each woman's going to be different, right? Depending on the range of their ovulation cycle or whatever. Basically, you got to count backwards from the pattern that we're seeing, correct?
Correct. And that's why having regular cycles is considered to be what we look for. If you're having a regular cycle, so your cycles are more frequent than 21 days or less frequent than 35 days, so outside of that range of normal, then we would want you to come in for an evaluation sooner rather than later and not wait that 12 months if you're less than 35 of trying to try to get pregnant, or 6 months if you're older than 35, because the likelihood that you're ovulating is actually low, or you have a higher likelihood of missing when you're ovulating.
And that's important to know. And I think also the ovulation, the cycle here is very important for guys and I think couples, because, a lot of guys will come into my office and be like, yeah, I ask, if they have a tracker, I ask how they're engaging in sex. And a lot of the guys will be like, oh, it's the window, doc. So I'm having sex like 5 times a day. I'm exhausted. I can't do this shit anymore. And I'm like, you don't have to do that. You don't, right? So, we know that sperm can live in the uterus for a few days. And, I think we all agree, when we talk about counseling patients for sexual intercourse and planned pregnancy, it's really an every other day. If you wanted every day, that's fine, but you don't need to be having sex like when that window comes up like 100 times. I don't think it's really going to increase the odds.
Yeah, just my brain's kind of going right now. Just a question. if you are doing it 5-6 times a day, are you optimizing, or are you kind of putting yourself a little bit at a disadvantage because your sperm count's got to go down on each subsequent ejaculation?
Absolutely.
I'm asking
Right.
you guys that. That's what I'm dying to hear,
Yeah.
because I have patients who are like, oh yeah, my guy's been saving it.
Oh, saving it's bad. You know, saving it is bad.
Yeah.
Saving it, we do show that there's studies showing that, optimal for semen parameters are really, 2 to 3 days. That's why when we ask for a semen analysis, we don't want you saving it. If you're a guy, and we do have those guys who say, oh, I've been saving it for like 2 weeks, I'm ready to go now, have like sex. It's the quality of your sperm is not good. You need to, clean the pipes. You need to just regenerate these babies. You literally do. I mean, so you're not optimizing yourself. You're just making yourself really tired and making yourself more stressed.
Yeah. And I mean, and by that same token, you see people who get super, super stressed out throughout the process of trying to get pregnant. And it really does take away like the pleasure and the joy from the act of intercourse itself. And so I think it's important, whatever a couple deems reasonable for them to have intercourse during that fertile window is what they should go off of, and whatever their preference is.
That's a great point. And that's something that Justin and I see often. The guys who also come in having a little bit more situational erectile dysfunction. It's kind of normal. Mm-hmm. It's stressful. Now sex, just like Adriana said, sex is not pleasurable. It's like a mission, at this point. It's like, all right,
it's a job, man.
We've hit the window. It's time to go, let's do this, and you're kind of put on the spot. And so it's kind of things that but we see it often, right, Justin? And so, we sometimes prescribe a little Cialis and stuff like that, but, it is stressful. It's a stressful, time period. Can be.
Totally. Okay. Let's see. So what happens at the initial male fertility visit?
Kev, you got this.
All right. So, at a male fertility visit, there's a few things that we do. All right. And, it's good for guys to kind of know ahead of time so they know what they're kind of getting into. All right. So first thing is we take a really detailed history. We just want to see if there's something that kind of, will kind of point us in the direction of possible concern. So these are things such as previous infections, previous trauma, something, even recent COVID. These are things that we want to know.
Right.
And next we do is a really, detailed physical as in we really assess, your scrotum. We're checking your testicular size, making sure that there's no anatomical variance, checking to see if something called a varicocele. Varicoceles are basically dilated veins that surround the vas deferens and can contribute to possible male infertility. Additionally, we do some blood work that includes hormones that basically tell us, is the brain interacting with the scrotum correctly? And additionally, to make sure that you have a good amount of testosterone. We'll talk a little bit about later about, the differences in what kind of testosterone is good for sperm health. But, at a basis, testosterone is important. And finally, the most important thing, and what most guys, love doing, is the semen analysis. And, basically that just tells us how much viable sperm is within the semen. And, we kind of have some markers that kind of tell us, hey, maybe this is a little bit low for, being able to achieve natural conception. Justin, did I miss anything?
No, but I mean, listen, so I'm going to ask Adriana this question, like, just to give a perspective once again, and we had a guest that gave us this again, these details before, but it's very important. We are literally talking to you, getting some blood work, touching your balls, and then asking you to jizz in a cup. And then now, Adriana, what does a workup, a quick summary for a fertility workup for a female? Because I guarantee you, it's not as fun as that.
Oh my goodness. Okay. So, I mean, a lot of it starts out the same like yours. So it's, history and physical, finding out if
balls too. No,
oh my goodness. And so, it's finding out if someone's ever been pregnant, also obtaining a very thorough gynecologic history of sexually transmitted infections. What birth controls have you ever been on? Is this the same partner as, previous pregnancies? Has anything else changed from previous pregnancies? And then depending on what that history shows us, we may go down a certain path with labs. We may also do a pelvic exam in order to see if there's any anatomic concerns similar to yours. We want to make sure that there's nothing concerning on our pelvic exam as well. We usually look at the vagina, the cervix. The uterus we can do based on feel during our physical exam, but then we get a better sense of things with the pelvic ultrasound where we're able to look at the uterus, tubes, and ovaries, and that's generally a transvaginal ultrasound.
All right. So, I mean, it's a little bit more invasive. It's a little bit more in detail, so guys.
And then do they do the HSOs? Do we do those?
Yeah.
No?
HSGs.
Or HSG, sorry. Yeah.
So we do. Some places have radiology do that, but some have OB-GYNs do it as well.
Gotcha.
And that can be very uncomfortable because you have to time it for, the appropriate time during the menstrual cycle. They're filling saline usually into your uterus, your fallopian tube. So
with the HSG, it's actually that dye that they're using to see if your tubes are patent, and that infiltration of the dye can be super crampy and uncomfortable.
So once again, guys, workup isn't that bad to see us. We're not asking much. Your partner's not asking much. I think it's really, really worth it at the end of the day. Now, Adriana, one thing kind of to follow up on this, when we're talking about fertility evaluation, the big question is always, at what age does female fertility start to decline? Can you give us some numbers and different age brackets for that, for people to really make sure that they understand?
Generally, women's fertility declines once you turn 35 or go into our later 30s and continues onward into our early 40s. But it's not that our eggs, once you turn 35 on your 35th birthday, they decide to just poop out and aren't good anymore. It's really a steady decline, and you see increased rates of chromosomal abnormalities, meaning eggs that will end up in a miscarriage, and we also see lower pregnancy rates.
All right. So 35 is kind of around the number, but it's still something you just have to be aware of, and I think that when it comes to men, believe it or not, we're not that different after all. For a really long time, It was always thought that, men can make sperm forever, which we can, but we can. That's the bottom line. I'm in Miami. I see guys coming in for, fertility care at the age of 70, right? So we can, but, the quality of that sperm we know declines, right, Kev?
Yeah, no, that's a great point. And for the longest time, it used to be like, well, yeah, the male side, the guys are going to keep making sperm. That's fine. It's going to go into their 70s, 80s. But, recent studies have really showed that exactly what Justin said. The quality starts declining. You're starting to see that in some of these studies, like age of 40. We're starting to see that, potentially that there could be rates in decline. Now, there's a lot of factors, and that's the issue with fertility, right? There's a lot of factors. There's lifestyle factors, which are kind of hard to study. You have your testosterone's kind of declining. So those are some things to kind of consider. And it's just factors, right? Generally men who are in their 40s, their partners may be a little older. So those are additionals to factors to think about. But from what we know, it seems like sperm quality does kind of decrease at 40, right, Justin?
Around your 40s, 50s, as you get older. So it is something that, age, unfortunately, for everyone is a factor, and it comes for all of us at one point, except for me because I'm Peter Pan. But
yeah, you don't look like Peter Pan, man.
No, I don't ever. I look way too hairy. I'm like Peter Pan, Paul Pan. I'm Peter Pan's father.
Oh my God. Oh my goodness. Okay, a question that I had for you guys is, what does, if a man is recommended to have a semen analysis, what does that process look like? Like, do you have to do it in the lab, or can you do it at home? Do you have to fill the cup?
Whoa, fill the cup.
How big is the cup?
My God. God. If you have to fill the cup, you'll be in there for 10 days.
Just take this one.
All right. So, the semen analysis process back in the day, I would say even 5-6 years ago, maybe less, was a lot different picture than it is today, for a good, and that's a good thing. If you were to come to a male infertility doctor probably 5-6 years ago, they would probably send you most of the time either to their lab or a reproductive endocrinologist like Adriana's lab to get a semen analysis. And typically, you would get that scheduled. Depending on, the busyness of the lab, you would pay the cash price, and, you would be told to hold off on ejaculating 2 to 3 days before, provide a sample. The lab would do its analysis, and I don't really know, every time frame for each lab is different, but usually you get it fairly quickly. It could be difficult. You could be very far from a lab, but that's really the only way to do it. Since then, there has been really some incredible advances when we're talking about semen analysis and access to information. So, there's a lot of companies out there. You can go on Amazon. I use some companies as well in my office that all you have to do is, go online, sign in, and basically they send you a kit and you provide the sample at home, and some technologies you can get a read right away saying, hey, your sperm's good, sperm's bad, without a number. Other companies, you send it away and they give you exact numbers. So there's a lot of different ways in which you can get semen analysis information, and there's a convenience factor. But I find that a lot of younger guys now who are, as we're becoming a generation of Fitbits and Apple Watches, where we want to know our general health information as a preventative means, we're starting to see more and more guys think about using this earlier on. And I know Kevin feels a certain way strongly about this kind of stuff, because I think access is important. Information is important. And Kev?
Yeah. So I think these new home tests are awesome. Something important to consider now, some of these tests that can kind of give you a read at home. These are still kind of information that us urologists or male infertility specialists and even REIs, we still probably want one that's done in the lab still, but it kind of is a good screener for you to kind of get an idea like, hey, how much sperm do I have? And that's kind of the extent that they can do. But the ones that get sent into the lab, those ones are really useful. They're done in like a lab setting. And also to kind of elaborate and just kind of give an idea, like these labs, let's say you're going to give the specimen at the labs, you're kind of in a room, there's a little, sometimes there's a recliner, sometimes there's a TV.
Oh, it's not like a bathroom. It's like an actual cozy room.
It's cozy, fine. We could use the word cozy.
I've seen some bathrooms out there.
But and so in this room, there could be some entertainment playing, and there could be some, handheld entertainment. But is the
entertainment diverse, for different preferences?
Oh yeah.
Okay.
Yeah. But usually they tell you nowadays. I think we've reached a point where they tell you just use your phone.
Yeah, the preferences are too diverse now.
Just as a side note, I've looked into these rooms, and I hope some of them they started putting a little bit of a paper sheet on the couch. I think that's a good idea.
So as a guy, you should ask for a paper sheet, right?
Ask for a paper sheet on the couch. What I'm saying. But in general, I think, listen, when it comes to filling up the cup, no. I mean, that's one problem, though, is seriously getting all of it into the cup. A lot of guys miss. Yeah. And when we're looking at a semen analysis, it is very important we know the volume, because that is a big factor in assessing your semen. So, if you are providing a sample, really make sure you time it right so you get all of it out. Now, I know some guys say, oh, it's different. I'm uncomfortable. I can't get fully hard. And sometimes when you ejaculate, you're not ejaculating as hard. So even if you got to milk out the rest, I know it's a big detail, but it's actually important. Get as much of it into the cup as you can. You're not going to fill it up, but
also tell the tech or the andrologist, whoever's there, if you missed, just tell them you missed. Don't be like, oh, here it is. Because then, the male infertility person is going to be like, hey, wow, is he obstructed? Why is his volume low?
Yeah,
but if you
that's a great tip.
Oh, I missed, I'll be like, let's repeat it in a few days or something like that. No,
right,
baby,
exactly.
Not a problem. So
it's a really, really good point. All right. So for you, now we were kind of alluding to it, before, but how long should, a couple naturally trying wait to get evaluated for fertility?
Oh, good question.
And it's obviously important for both sides. Tell us what are the rules that you guys go by?
Yeah, so the guidelines are 12 months of trying if you're less than the age of 35, and then 6 months of trying if you're over 35. Now, that being said, there are some reasons that you should go in sooner rather than later. If you're having irregular cycles, meaning, outside of that window of 21 to 35 days, the likelihood that you're catching your ovulation or that you may even be ovulating is lower. So you should go in sooner rather than later so that you don't waste that time. Another reason would be if you've had problems with infertility in the past and you've required IVF or other forms of assisted reproductive technology, you may need it sooner rather than later. Another reason would be if you've undergone treatment like chemo or radiation, you may also require some assistance. So these are all good things that you should kind of keep in your mind if you're trying to get pregnant. And if you are making the decision to start getting pregnant, you should also see your OB-GYN because there's certain preconception things that we can do just to make sure that your health is completely optimized.
Really makes sense. And, obviously you're talking about the age for the female partner, but, the timeline is also very important and very important for male partners to understand, and I think a lot of the time is when your female partner gets checked up, the rule is you get checked up too.
Yep.
I think that's pretty much how we roll here. But I want to go now into kind of some lifestyle factor stuff because I think that that's really important because fertility is a really interesting one, at least for men, where a lot of the things that we see and when it comes to fertility can be impacted by, your lifestyle and things that you're doing. And I'm going to start with you asking you a question first, though. Is there any specific lifestyle things that, a big glaring one that you feel like female partners need to be aware of that they are doing that potentially are putting themselves at risk for infertility?
Yeah, I mean, if you smoke, stop smoking. That has a huge impact on your egg quality. Even marijuana has an impact as well. Any drug use, alcohol use, if you can cut back on any of those things or quit them altogether, that will improve your chances of conception a lot. What about you guys?
Well, let's start off with smoking. All right, let's start off with smoking. So smoking's bad for you. There's no way I'm going to tell you right now that smoking is going to be optimize your male fertility. So smoking is bad. And that is one for sure. I can tell you that's going to potentially, be a lifestyle factor in male infertility. You cigarette smoke, you got nicotine, you got carbon monoxide. These are all things that can cause DNA damage. And it's important because that's some stuff that's a little bit, more harder to kind of detect. A regular semen analysis doesn't really detect DNA damage, right? We do have tests that do kind of further that, but a lot of times these tests are extra money on top of everything. So these are not conventional tests that we would do right off the bat. So, so from that standpoint, it can affect the DNA of it. It can also reduce the sperm count, motility, and morphology as such. But yeah, in general, smoking is bad. Justin, what about marijuana?
Well, I want to also comment on a more increasing trend too is vaping. And vaping, vaping is also important to understand now. There is limited data because I think it's a newer thing, but I'm seeing more and more guys come in, especially in, South Florida area, who are vaping at least daily and sometimes, more socially, when they're out. But while there is limited data, I think the thought process is the same in general. You're putting some foreign chemicals into your body, can cause inflammation, can cause, a not ideal environment for, sperm to live in. And there has been some data, at least in mice and very limited data in humans suggesting that, they can cause inflammatory issues and potentially compromise your fertility. So, smoking in all forms, and vaping is one of them, is not good. And then that leads to marijuana. And, Data for marijuana is starting to suggest that it can potentially compromise semen parameters, things like sperm concentration, motility, morphology, like you said, and hormone levels like testosterone, LH, and FSH have in some studies been suggested to be compromised by marijuana. But, I think the problem with marijuana and what, for some people, and I've seen a lot of guys, they say, I need it. It's a mental health thing. I smoke daily, or I smoke a decent amount. And, I think the problem inherently is I don't know what too much is. They'll be like, well, I'll reduce, I'll smoke less. And I think that we all have this issue because it's not regulated well. Like, I don't know if edibles versus, smoking it versus, blunt, a spliff, however you smoke it, really makes a difference in how it impacts your fertility. And there's just no data on it, and it's no one's fault. But like, I don't know if taking 1 gram of an edible versus a 5 versus 20, really is going to impact it differently from another thing. So I think I agree. If you're really serious about optimizing your fertility, and we're not narcs or anything like that, but like, if you're serious about it, you probably need to cut out the marijuana, or at least limit it significantly. I don't know. Thoughts, guys?
Yeah, no, I agree. I mean, if there's anything that you can modify in your lifestyle, I think it's worth it.
It's an interesting question. And it's one I always have a discussion with my patients about, because these are like at the root.
Well, you're in LA too. Everyone's smoking weed because it's legal. But here it's Florida. It's
right.
Florida too.
But just like in general, just like lifestyle, like let's just talk lifestyle, right? Other ones are like alcohol. They bring it up. And the interesting thing is, what I always tell patients is like, look, there are people out there who are drinking a ton, and having no problems conceiving, right? And that's a fact, right? We see that.
Facts.
But we do know that alcohol can cause male infertility. So how are we able to guide and counsel correctly? What I always tell patients is like, look, you're here in my office, so probably you're having issues. Like there's, most of the time we do, we see patients who are there for kind of just a general workup. But my kind of rule of thumb is like, well, you're here. So there's a sense that you have that there could be an issue, right? And if there could be an issue, the things that you can modify or you can probably fix are probably things that you should do. So if you're in my office and you do drink significantly, and you're like, oh yeah, we've been trying, hey, look, probably the drinking's, contributing, or the marijuana is contributing. And, I'm not saying to stop it cold, but things in moderation, or just to consider.
Moderation, man. Moderation is key. I think a lot of the times I totally agree. I think we're not robots here. We're pretty reasonable people, and I also don't think it's realistic for you to go into a room and talk to a patient and be like, cut out everything in your life. Be like, life is hard, like a lot of, it's like, people are stressed. They're having sex and they're stressed about having sex. Yeah. They probably want to have a drink. They probably want to be a little high. I get, like that helps cut it. No, but that's a realistic thing. I mean, I'm not saying everyone's high, but it's a realistic thing. So I think, talking about it, understanding these things is really important. Now, Adriana, we're going to talk a little bit about hormones, because one thing that women often do for fertility purposes is, they have to sometimes, to get regular cycles, like you talked about, was really important. They do have to start on potentially some hormonal treatments and therapies. Can you kind of just give us a quick breakdown for some of those treatments that they may need to at least get regular for fertility purposes?
You mean only for pregnancy?
Yeah, for pregnancy.
Yeah. So if you have irregular cycles, there are certain medications that we can give you in order to help you have a higher likelihood of ovulation. Some of them are oral, and also some of them are injectable, but it just depends on what your doctor thinks is the most appropriate for you. But basically, it's to overcome that barrier of the likely problem with ovulation.
Yeah, it's pretty interesting, because in general, women come to the REI and they're given, if they need it, some kind of hormonal therapy, especially obviously during the IVF process, is a whole other very, very intense thing. But a lot of guys, when it comes to us, are coming in for infertility because they were on some kind of
Oh,
hormone.
yeah, that's such a good point.
Right? And that's kind of where I was going with it, that they are actually on something and we have to take them off of it. And I'm talking about testosterone. So, testosterone is a huge problem when it comes to male infertility.
Yes.
Kevin, can you just give us elaboration on testosterone and its role in infertility?
Yeah, absolutely. So look, I mentioned earlier, testosterone is important for sperm production. But, there's two types of testosterone. There's the testosterone that your body makes, and then the testosterone that you receive wholesale, right? And this is known as testosterone replacement therapy. So a lot of guys who are bodybuilders, such not, who take testosterone, whether it be injectables, topical, oral testosterone, any of these things are going to shut down your system because you're telling your body, hey, I've got enough testosterone. So it shuts down the system that is necessary to make sperm. So what happens? You show up, you're like, hey, I've been trying for a year, hasn't been happening. And, you do a semen analysis and you've got no sperm whatsoever. And, Justin, what do we do in these situations? And what's our kind of protocol?
Well, it's really important that guys understand what you said. So there's data showing about 60% of men on testosterone develop what we call azoospermia, or no sperm in their ejaculate while on testosterone.
And that's reversible or permanent?
That's the important question. And in general, it is reversible. The good news that, data suggests that if you stop the testosterone, in general, majority of people have return of sperm to their ejaculate in about 1 year, almost everyone by 2 years. But, that's a long time, right? When we were just talking about age and time being a big factor here. And 2 years, if you're 35 and you jump to 37 and you're not starting the process, and it can take a really long time. So there are things that we can do if you are struggling with low testosterone. And in a similar pattern of guys who present initially with low testosterone, is our goal is to optimize and help you create more testosterone naturally. Now, there's different medications that we can use. And then actually, you guys, Adriana, use similar medications for what you do.
I try to source them from the same pharmacy.
Yeah. So, the medications we use are Clomid, which is a selective estrogen receptor modifier. Basically, it signals to your pituitary gland in your brain to continue to make more FSH, follicle stimulating hormone, which tells your testicles to make sperm, and LH, which is luteinizing hormone, which tells your testicles to make testosterone. So it tells them to make more of that naturally, which hopefully will increase your fertility and your testosterone. There's also another medication, HCG, which you guys also use, which is basically what we like to call an analog. It's similar in structure to LH. Basically, this one is not oral. Clomid's oral. You inject yourself, and people have different protocols, usually 2 or 3 times a week. And basically, that your testicles, the LH receptors, read HCG as LH and promote not only testosterone, but it's actually also shown potentially spermatogenesis as well. So there are medications that you can take to increase your testosterone naturally, and not only not compromise your fertility, but actually potentially increase it. So it can be exhaustive, but I think the main point here, and I think you guys would agree, is if you're thinking about taking testosterone, go to a urologist, go to a andrologist, talk to your local healthcare provider before doing it, because there's a lot of risks and benefits that you may not be aware of. I did a study where I was a secret shopper, and 50% of these companies online didn't mention that they could cause fertility. And that's a problem. So very, very concerning. So something you need to be aware of.
Yeah, that direct-to-consumer marketing is so crazy. I mean, you see it everywhere.
Yeah, there are benefits.
Yeah, right. The thing is, Adriana, it's everywhere, right? But it's
right.
There are really good things about it because we're getting access to patients. But it's important that they're well informed. So we're trying to do our job here, but at the same time, they also got to do a part to kind of inform, because you're going to get a bunch of guys on testosterone And then we'll see them in the office, and they're going to be azoospermic, have no sperm in the ejaculate, and they'll be like, "I didn't know," and that's not a great answer. So,
and you
Not a
brought
great
up
answer.
Clomid, and it's so cool that we use some of the same medications. At least for some women, it can give them menopausal symptoms. So it can kind of give you like hot flashes or vaginal dryness. What does it cause in men?
Honestly, it's
Wow.
pretty well tolerated medication.
Wow.
It's
I knew you were going to say that, and I was dreading that.
some GI issues. I've had guys honestly say that they almost felt like they had a hot flash, or they felt like super energetic. So it's not out of the picture. Usually though, guys after about a month, they're kind of out of that window where they feel that. But I have had guys say, they felt like they were having a hot flash, or they weren't used to having, the higher testosterone. And in general though, I think, Clomid is not going to make you feel the same as if you're on TRT. So guys who have taken testosterone, they put on Clomid, the expectation is you're not going to feel like you're jacked up like you are on testosterone, because it's just a different experience. Your levels are not going to go as high most of the time. But I think it's a really well tolerated medication. I don't know, Kevin, anything I'm missing?
Well, I do have some patients who do complain, and a lot of them are the ones that were on T. And just like the point you made, it's a very different, like T's, you're gonna have your your peaks, like that's what we call it. You're gonna kind of peak. Clomid, you don't, right? Clomid, you're not really spiking your testosterone levels. It's a much more plateau. I do have some guys who sometimes, come and talk about water retention, feel like they're gaining a little bit weight. I do see some of that. But otherwise, yeah, I echo what Justin said. For the most part, it's well tolerated, as long as you're not expecting a T high that, for the patients that were on TRT before.
So if men have a problem with their fertility, is this something that can be cured or treated, or is this a diagnosis that you just have to live with?
Well, it really depends, right, Justin? It depends. Look, male infertility, when you look at the diagnoses, there's a list of them, right? Let me just go off with one of them, right? First off, there's these two medical terms that you may kind of hear, it's non-obstructive azoospermia and obstructive azoospermia. I'm not going to kind of dwell on here and go into medical terminology, but basically it's just saying, like, are you having a blockage of getting your sperm out, or are you not producing sperm? Those are really kind of two different things, right? You're producing enough sperm, but you can't get it out, or you just have a component that's not producing sperm. When you're talking about cured means like we can reverse the process and then you're going to be able to conceive naturally. I think that's what people think. And if it's something that's blocked, I think we have a little bit more at our resource. We can try to do some reconstructive surgeries to try to get you unblocked, right? And so if you want to think of cured as natural conception, that's possible. When it's a production issue, that's a little bit more of an issue, because, we kind of go into a little bit more detail, a little more further workup, but kind of in those kind of aspects, it's not able to be cured, but we can kind of treat it, or at least try to get you to conception, which is the goal, right, Justin? Or to a live birth, right?
Yeah, no, and I think, there's a spectrum of cured and treated. Obviously, the goal is always for you to have your own offspring through whatever means possible. Now, if there's lifestyle issues, we're going to optimize it, and then maybe we can treat the lower sperm count, or sometimes zero sperm, because maybe you're on testosterone. Oh, one thing we didn't mention, because you're going in a hot tub, sauna, jacuzzi every day, because you're smoking cigarettes. So these are things that we can potentially, that are very easy to do, or easier said than done, that can really treat your low sperm count. Sometimes I've seen guys with near zero sperm doing all these things that have return of sperm to their ejaculate. Surgeries you talked about, varicoceles we mentioned. But in general, I think a large portion of patients that come with a fertility, whether it's zero sperm in their ejaculate or low sperm, have a good opportunity to walk away with a child, especially if you have sperm in your ejaculate, even if it's low. The guys who have zero sperm in your ejaculate and a production issue, it's still possible, but it's on a case-by-case basis. And it's hard to really give numbers. But, the important thing is in this process is, it does take two to tango. So, while you may be struggling here, you also have to realize that, even if there's not a female factor involved, if you have a very low sperm count and you're not conceiving naturally, guess who's going through the other end of the treatment? It has to still go through IVF.
That's a
if you have
great
no
point.
sperm in your ejaculate and we have to go to the testicle, guess who still, even if they're completely fertile and they have no problems, who has to go through the other aspect of it? It's still the female partner. They still have to go through IVF. So it's a really, really interesting thing that, we kind of take for granted sometimes because, hey, we sometimes have to ask the partner to overcompensate for something that, so that we can have a middle ground and have a baby. I don't know. Adriana, what do you think?
I mean, I think it's reassuring to me that you guys, at least from your guys' perspective, you feel like there are some things that, are surmountable with the technologies that we have in certain conditions that at least with some lifestyle modifications can be worked through. I think a lot of the times, at least from our female end, there are, sometimes you just throw the kitchen sink at it and we just see what works and we don't really know how or why it's working, but there's sometimes multiple factors at play and we don't exactly know what it will take to get to that pregnancy. So yeah, I agree. I mean, I think whatever we can in order to optimize every little bit of it.
That's, fertility still, there's still so much we don't understand, right? That's why, unfortunately, with our technologies of what we still know, it's still not like 100% in being able to get to a live birth. But I think what REIs have done and really advanced this technology to really get us there for a lot of patients who are suffering with infertility has been really amazing. Though, really provides that that opportunity that, many years ago before IVF was created weren't afforded, So.
Yeah. And I mean, correct me if you think I'm wrong, but I feel like just like more than ever before, there's just been this focus on our fertility. Now that at least like I'm in my 30s now, I feel like I hear my friends talking about it all the time because we've been trying to prevent pregnancy our whole lives. And then now we're kind of confronted with this reality that it may not be as easy as we had thought. So I think, at least I feel like my friends are talking about it more than ever. And it's amazing that we have these options, but they're certainly not perfect or 100% effective.
I think it's a really great point. And especially it's like you see guys and girls come in and they go, I went through school saying if I have sex once, I'm just going to have a baby. And I've had sex like for the last 2 years and I've got nothing going on. What's up? And it is the reality of the situation. And I think it's important to understand that you're not alone in this process. You just said it yourself. You have a lot of friends, people, they talk about fertility. Kevin and I guarantee you, I've had people I know ask about fertility. It's just one of those things that is important. And I think one of the highlights that we've kind of talked about today is it's unfortunately sometimes a good surrogate for other stuff going on in your life. So, I think, especially when it comes to lifestyle. So if you really are serious about, having a kid, you should be serious about taking care of yourself. And I think that goes for, and being a good, open, communicative partner is also part of that.
Couldn't have said it better myself.
Well said, Justin Dubin. Well said. Well, hey, this was a great conversation. Yeah. This was awesome. Adriana, thank you for coming on. This was a pleasure.
Thank you so much for having me. Felt like we were just hanging out.
We need to hang out soon, IRL. I don't know. We'll see if I'm going to. I'm cool. I say IRL.
Yeah, I know.
No, you're super cool. Yeah, are you guys going to go to ASRM?
This is in New Orleans next year, right?
Yeah, that'd be lit.
Yeah, maybe.
Gonna try.
I've been to New Orleans like 4 times in the last 14 months.
Yeah, weren't you just there?
Yeah, I was there for Mardi Gras, so that was awesome. But probably took away a year of my life, but that's fine. I
thought you were Peter
Pan.
Anyway,
so a Paul Pan.
Oh, yeah. Pan. I didn't know Peter Pan. I didn't know Paul Pan was Jewish. Oh my God.
Anyway, so tell our listeners where they can find you, because truthfully, you put out some amazing content, really informative content on TikTok and Instagram. Really awesome. Make sure you follow Adriana. Where can our listeners find you?
Follow me at hold on. What is my handle? Okay, hold on. Sorry, I'm not used to saying it. Okay.
We're keeping this.
Oh my God.
Yes, absolutely.
You can find me at Adriana Wong, MD, ADrianawong, MD on Instagram and TikTok. And I don't know what to say. Okay. Follow me on Instagram and TikTok at Adriana Wong, MD.
Perfect. That's great. She's awesome. Make sure you follow her. She's got, like I said, really good. We go up and see, now you're messing me up here. Really good content. But for our listeners, as always, find us on any podcasting platform. Give us a review, download, subscribe, 5 stars, really pushing our reviews and comments. Please, really appreciate it. You can find us on all social media platforms at The Man Up Pod. Find us on YouTube. Subscribe there as well. Kevin, what's our website?
Our website is www.themanuppod.com.
For Adriana, Kevin, and I, thanks for listening. Until next time, have a good one.